Thank you. He's maybe playing. Oh, here he comes.
Okay, right. Thanks, everybody, and welcome to the meeting of Social Work Services Committee on Tuesday, the 16th of February. It's gone 10:30, and we're holding this meeting online.
Stephen, it's March, son. No
Thank
February.
you, Davey. I stand corrected. And
I don't like to contradict you.
No, that's fine. Thank you, Vice Chair. Yes, so welcome to the meeting on Social Work Services. Obviously, it's March. It's a lovely day, I have to say. Hopefully it is where you are. We're online, so firstly, as Chair, I'll approve the use of online participation in the meeting so that we can participate fully using the digital technology we have in front of us. The meeting will be live streamed, recorded, and subsequently made available for public viewing purposes. So if we just press on with the meeting in front of us, could I first go to the Sidran and apologies for today?
Morning, Chair, morning members. We've got 14 members currently present. I have no formal apologies, although I do have notification from Councillor Ferguson and Councillor McGregor that they will join the meeting as soon as possible, as they're in another meeting at the moment. Not present at the start are Councillor Dougie Campbell, Councillor Charteris, Councillor McClelland and Councillor Sloan and Councillor Wood.
Thank you. I should say that Councillor Dougie Campbell had intimated his apologies yesterday to me, so I should have passed that on, but if that could be recorded, please.
Yes, thanks, Chair.
That's fine. So next up we have declarations of interest.
Chair, I have my hand up, sorry.
Sorry, Andrew, I didn't see that on the screen there. On you go.
Councillor Wood is having internet issues at the minute, and he may be an apology, he may not, depending on his situation. Councillor Charteris is an apology.
Okay, thank you. So if we can maybe note that, and obviously if he arrives, that's great, but he can be recorded as an apology if he's unable to attend. Just on a point of housekeeping as well, if we can make sure that when we're not speaking, if we turn our mics and videos off, just to aid with the presentation of this online and just to help the meeting flow a bit more smoothly. So with that then, I presume we have no declarations of interest. I'll take that as a no. And if we go on to the minute of the previous meeting, which did happen in February, that's for noting. Are we happy to note that? Okay, I can see some comments in the chat noting it, so thank you for that. We can now go on to item 4, which is the transformation programme, and this is early and effective intervention family support work. We have both Chief Social Work Officer and Stephen Morgan here to speak to this. Obviously, we'd asked for this report, and it follows through the progress of this piece of work through the transformation change programme. So I'll hand over to the speakers. I don't know if it'd be Lillian or Stephen who wants to pick this up first.
Morning, Chair, morning members. I'm happy to hand this over to Stephen and take any questions. And Sarah, who is the lead manager for the project, is also on the call if required. Thank you, Chair.
Okay, welcome Stephen and Sarah. I'll hand over to you now.
Thank you, Chair. This is an update about the early and effective intervention team, and we've been operational for a number of months now. Delighted to say the service has been an absolutely integral part of our response to the COVID pandemic. As you'll see from the paper, we've worked with 47 families and 67 children within those families over that period. Those numbers have increased since the publication of the report. The two main elements to the support that we're offering is the early intervention, which is really trying to keep children and families together and out of statutory systems, and that's working well. And also the intensive intervention, which tends to be situations that are more complex, but we need to intervene really quite intensively to keep families together. And we've been successful in both of those areas of the service. I think what I would like to add before opening up to questions, and I'm delighted that Sarah's here to answer any questions as the lead manager, is that throughout the period of the pandemic, one thing that's changed the most for us as a social work service is that the children and families who we're here to work for don't have the same access to family support, the same access to community support, etc. Therefore, our staff across the piece.
Thanks, Stephen, and thanks, Sarah. We do have some questions. So first up, Councillor Giusti.
Thank you, Chair. One of my questions is regarding you said about the lack of support and community support for some of these families. Does that mean the likes of Wigtonshire, where there is less support in the sense of community organisations, etc., there's less authority support, etc. Does that mean that you've got a bigger job in the likes of Wigtonshire and in the ruralities rather than in the more urban areas?
If I can clarify the point I made, apologies for that. What I meant is that families have less access to the supports that would ordinarily be there. Now, clearly, the type of support that's available across Dumfries and Galloway varies from area to area. So the point I was making was that the families have less access to the supports that they ordinarily would.
Thanks. Councillor Giusti, does that answer your... I think this is in relation, obviously, to the restrictions around COVID generally just now. Does that help answer your question, Councillor Giusti?
No, that helps answer it. No, it's because I know that there is from previous social work committees that there is a specific problem in Wigtonshire with family support, etc.
Okay, thank you. Now, are there any other questions in the... I can't see any hands up, so if you do put your questions in the message function, it's much easier to capture. I mean, just while I'm waiting for people to put that in, one of the things I did want to raise was just about, obviously, this is a sort of intervention, if you like. Part of the project is to, try and reduce the number of families going to be needing our services in the longer term. And obviously, it can get quite intensive. But COVID obviously has had an impact on that, as you just touched on, Stephen. But what's the sort of lifespan of the services we'd be providing to families? Obviously, it's meant to be a shorter intervention to reduce the likelihood of people needing longer term services. But are you able to speak to that a little bit?
Yeah, I'll start, and if Sarah would like to add anything, then if you could welcome her to speak, that would be fine. There's two elements, Chair. The first one is the early intervention, where that tends to be children of families that we haven't previously known, and we're trying to get in there to stop them coming into systems. And that's one of the key parts of this particular project. So that's where you would expect a shorter term piece of work, but that can vary from family to family, and we haven't kind of tied ourselves into a set number of weeks as we had in the previous pilot that we'd had. The second part is working really intensively with families, and quite often with families who we already know, to try and really build their skills so they stop coming back into service again and again and again by raising their skill set as a whole. Sarah, I don't know if there's anything that you would like to add to that.
Well, just really to thank you to explain that we would initially spend a little bit of time building a relationship with the family and agreeing with them what support that they feel they need. We would develop a timeline with them so that we can look with them at how long we might be involved working with them. And that if it's just the family support service that are involved with the family, then that's fairly straightforward. But if it's a more complex situation that involves the social work team and other agencies, then we would fit into the timeline that they have for working with the family. So we might also be at the end of that involvement just to help families build their own networks so that they won't rely on social work support in the future.
That's helpful, thank you. I see Councillor Maitland wants to come in.
Thanks, Stephen, and thank you, Stephen and Sarah. Just sort of 2 or 3 questions as I was reading through this. We seem to have lost a family support worker since the first suggestion. Originally it was 14 workers, and now it seems to be 13. Maybe you could help me with that. There's also an issue in my mind. Do these families have bandwidth that you can always make connection with them adequately? I see an awful lot had to be done online, and I'm sure that might have created difficulties, and can we overcome that? And the third question I've got with your indulgence, Chairman, is about the use of the monies from the third sector. Abalour appears to have levered in colossal amounts of money on the back of what we've been able to provide. And I just wonder if there was anything further that we could do to kind of double or triple our money. If I might come back later on, if that's all right, Chairman, but let's leave it there for the time being.
Okay, so there's three things. There was the number of family support workers, the online bandwidth, and this maybe a more technical or practical issue about connectivity, and then the use of the money to leverage in external funding. So I don't know if you want to take all of those, Stephen, or give them up.
With your permission, Chair, I'll take 1 and 3, and I'll leave Sarah to give you the detail around number 2 because she's much more aware of the specific families than I am. In relation to the first point, the numbers of family support workers will go up and down dependent on them getting other employment and the likes. We've also utilised some of our existing like permanent resource, if I call it that, to put a full-time senior social worker into the service. So we are utilising the funds fully. We will go up to 14 full-time equivalents. We might drop down to 11, just depending on how the recruitment happens, and that might reflect differently from one reporting period to the next. So I can assure you that we are utilising the full resource to the best possible way. And sometimes we'll amend the type of staffing slightly depending on the need of the families that come to us, if that makes sense. And Councillor Maitland, in relation to the third sector, yes, our £35,000 towards services with Abalour was one of the key factors in them leveraging an awful lot more money into Dumfries and Galloway. And as all members will be aware, trying to increase community supports was a key part of our transformation programme. And we are absolutely trying our hardest to further our good relations with colleagues in the third sector to see how that can be done as we move forward into the future. And I think it's been a tremendous response from Abalour and their funding finding efforts. Sarah, if you can answer question 2, that would be fantastic. Thanks.
Yeah, so we've been able to access quite a lot of devices and internet for families through Connecting Scotland, through schools, through charities. So a lot of the families we work with have been given devices. They've also been given internet for 2 years, but we are working face to face with families. We are doing quite a lot of visits. We've had some families coming into the office if they can't access meetings, obviously with that all planned out really carefully. We're also meeting with children to go for walks, meeting with families. The work is being quite creative, so we're making sure that everybody has access to the service and that technology doesn't prevent that.
Thank you. Councillor Maitland, does that help address the points for now?
Thank you, yes.
Okay, thank you. I've got Councillor Giusti wanting to come back in again.
Sorry, Chair, I don't want to be greedy. First point is Graham Bell has lost connection, and there may be an apology if he can't come back into the meeting. And he's quite disappointed with that. But on to my question for the officers. So I read here that there's a total investment per year of £605,000 between the actual investment and the investment in working with the subcontractor sector and commissioning. Now, when I came and done a couple of days with the social work team, I mean, one of the aspects of this particular programme was that it was a spend to save. I don't know if you'll have this this figure to hand, but you're working with 47 families and 67 children. If you weren't in existence with this programme, what do you think? What would the estimated cost be to the council or to the public sector just to firefight some of this if this service wasn't on?
Okay, that's, what I'll do is, I think, I'm not sure if that would be best answered by Stephen or Lillian, but obviously there's, as the report sets out, these are for families who may not yet reach the threshold of being required for us to actually provide a statutory sort of response, or it might be more complicated than that, but it could be there's a threshold there that we aren't yet hitting, if you like, but we can foresee that it could be a problem in the future or whatever. So I don't know if that would be Lillian or Stephen best to pick that up. Stephen, on you go.
Yeah. Thank you, Chair. In relation to figures, no, I don't have figures to hand, but what I would say is when we do the early intervention with families that wouldn't ordinarily meet our threshold, we know that if we can get in early and stop people coming into the statutory system, that does add significant value. I wouldn't say it's cost reduction necessarily. We would class it as cost avoidance, if that makes sense. So if we can stop people coming into the system, we're less likely to have to spend an awful lot more money in the future. But that doesn't necessarily mean it would be a saving for the service. It would just mean that as time goes by, we would be spending less as opposed to reducing a budget as such. The point about what would happen if we didn't have this service right now, if we're looking at the intensive intervention that the staff are doing, that would fall to our existing staff. And we know that our staff have been, I've used the term previously, that we've been sprinting through the pandemic. And that's absolutely right. That social work staff at the front line have been some of the most kind of responsive, and they've been sprinting now for about a year. And it's difficult to keep that up. So if we didn't have this service, our existing staff would have to try and step into the breach for that intensive support for the families we're already working with. And I do believe that we would have seen increased sickness levels, some staff burnout and the like. Now, clearly, that's just an opinion of mine. It's more than an opinion. I've done a lot of staff focus groups and spoken to almost all of our frontline staff. So I do get a true sense of how exhausted and how demanding the post can be. So if we didn't have this service over the past 6 months or so, that would have had a significantly detrimental impact on our staffing group, but also our ability to respond to some of the families who are in greatest crises.
Chair, I wonder if I could also add an element. Thank you.
Yes, please do.
Thanks for your question, Councillor Gusty. I think as well, I have talked at various forums to members around just the increased demand for social work services during the pandemic and the ongoing response. So it is an area that Stephen and I are very concerned around, the increased demand for services for children. And up until the 31st of December this year, compared to last year, we had near enough a 40% increase in terms of referrals. So if we didn't have this additional support, I think the challenge that we're facing, which is significant, would be even more to the fore. So just a reflection, and certainly at some point I will need to come back and share with committee some of the challenges that we're facing moving forward, and that's a piece of work that I'm kind of undertaking just now. So we certainly have an increased demand for our service, particularly around children and for families that we've never known before, and that brings its own challenges, as I'm sure Sarah and the team are finding at this moment in time. So really vitally important that we continue to intervene at the very earliest opportunity. Thank you.
Thanks for that additional information, Lillian. Just on a technical note, I believe Tracy is now trying to contact Councillor Bell. Obviously, it's unfortunate he's had connection difficulties. And I see that Councillor Murray wants to come in.
Yes, it's really more of a comment, I suppose, than a question, but I just get a little concerned when I hear about these things being assessed in terms of how much money are we saving. The point surely of this is that the outcomes for the children would be so much worse if we didn't have this service, and that really is the important thing, because the outcomes for those children and young people could persist for the rest of their lives in terms of offending behaviour, times in prison, broken relationships later on. So let's not just be so narrow-minded we think this is about saving money, because it isn't. It's actually about improving the quality of children and young people's lives going forward. Thank you.
Yeah, thanks, Elaine. Apologies, I had a little technical issue there. Yeah, and a point well made. I think money is sometimes a convenient way of expressing value, but it's not always the grubby, filthy lucre that we might think of. But it's just how else do we measure something? Money seems to be just a conventional way of saying that's what it would cost. But really, we're talking about emotional opportunity, future harm, etc. All these things we can't really quantify it in pounds and pence, but still we have to provide a service and we do have to employ staff. So it's a difficult one to answer simply. We do have, I think, Councillor Juicy's wanting to come back in. Is that correct?
Yes, yeah. It's just to say that my question wasn't necessarily purely around financial value. It was also about the social value that's been added, and also the value to the service in the sense of saving social workers, etc., time and maybe pushing them to break point and going off sick, etc. So I know that my question sounded very much around the financial side, but there's also that social value. The officer's answer that.
Okay, thank you. You're fading out a little bit towards the end there, Councillor Giusti, but I think your point came across. I see Councillor Maitland has added a comment about case study 1, which is one of the appendices. Obviously, it's quite early in the process at the moment, so it's maybe hard to find suitable case studies, but I just wonder, is that something you could touch on? The comment was really about, some of the how that case study 1 came across, and why that person might not already be in our system, as it were. But I don't know if that's something you'd be able to offer any comment on through yourself, Stephen.
Yeah.
Or indeed Sarah.
What I would say, generally speaking, is because we're so early into the work that the team's been doing, an awful lot of the cases that we're working with are still live, and we've been therefore very careful and also quite restricted in terms of the case studies we could offer. But I'll happily hand over to Sarah to give a little bit of detail about this situation, which will answer Councillor Maitland's query. Thank you.
Okay. Yeah, this is a family that will have had been in and out of social work involvement over the years, depending on their situation. And it is one of the ones where we're working closely with the Children and Families team to provide support. But the aim is that if we can get this right for this family just now, supporting the whole family and helping that family to build up their networks and work together, it will avoid our involvement in the future. So it is quite a significant piece of work of everybody working together alongside school, alongside other supports that are there for the family, building up for them so that they can cope in the long term. So this probably will be a longer piece of work, and the aim is to keep that family together and working with all their extended family members and community so that they can stay together in the longer term. So yeah, this is one of the more complex ones that we've been working with.
Thanks, Sarah, and I hope that adds a bit of depth to the case study in terms of just context and what we're faced with. Obviously, there'll be more information as the programme goes on, and clearly our current COVID restrictions sort of queer the pitch, as it were, in terms of how well we can measure the impact and effectiveness, because it's such a big impact already on everybody's lives. So just one final question. I don't see any more in the chat, but actually to do with effectively how we're commissioning services. Obviously, we've heard a little bit about how Aberlour have levered in a lot of external funding. Obviously, at some point, we will, as a committee or as a council, want to monitor how well our commission services effectively are performing. And there is a sort of council-wide piece of work, obviously, in terms of maintaining and updating the contract register, some of which will be relevant to children and family services. And ultimately, I'm sure we'll come to this committee or through clinical and care governance, IGB, for example. So, and on the back of also the paper on our care services nationally, obviously, which is certainly being circulated at the moment with recommendations to government. So, in terms of our contract monitoring, what will we be able to expect at committee? Because it's certainly something I think we should see in the future. I appreciate it'll take time to pull that together, but and it's maybe not the highest priority on this day, but certainly it's something that we will want to be able to see going forward. Is there anything we can expect to see as a committee?
Yeah, I'm happy to take that question, Chair. We certainly will, as a service, report back to committee on our commission services throughout the financial year. So I would propose that we'll probably bring that back to committee around about July, August, once the end of the financial year, and we've had an opportunity to reflect on the monitoring process of all of our contracts. And that will need to link in with the IGB reporting period in terms of adult services. So I would, I'll have a look at the timetable, but potentially that will be around probably the first committee after recess, dependent on the dates. I'm not 100% sure those have been set yet, but we certainly can bring back Social Work Services Commissioning report overall, or we can do it individually for children and families if in whichever manner the committee would wish that, but certainly happy to do so. Thank you.
Thanks, Lillian. That's helpful. And I see Councillor Maitland wants to come in possibly on that point.
Forgive me, Chairman. No, it's not. Although that's interesting and helpful. So thank you for raising that. No, it was rather more about the report going to education about attainment for looked after children. And what I was really wondering about is how does this work directly contribute to what's going on in the education side of things? We I think probably want to make certain that there are links across, and it would be useful for, I think, this committee to understand how it is contributing, its work is contributing, work being done in education. How do these linked workers, how do these family workers demonstrably assist with education? And I've got to be in my bonnet about it because it's absolutely obvious. Looked after children at home do considerably worse education than children who are looked after babies. That's been consistent for many years.
Chair, I can't hear her. She's breaking up. I don't know whether she's not sitting close enough to the microphone or what it is.
Well, okay, there does seem to be a connection issue there, Councillor Maitland, but I think the early part of your point seemed to be about how we measure and link up across with education. So obviously how we measure and what impact this programme is maybe having across other council services, particularly with education, which obviously we have later this week. As for the remainder, I think I got to the bit where you had a bee in your bonnet, but maybe there was another point to come after that. But if we can tackle the first part, if that's okay, because it's a fair question, and then maybe there's a connection issue, or even if you type the text in the chat, we can maybe pick it up that way. Okay, I don't know whether that should go to yourself, Stephen, or Lillian first.
Stephen can take that, thank you.
Okay, thank you.
Thank you, Chair. In relation to how this service impacts on education, then we're looking at that currently on a case-by-case basis for those children who are new to us and are not looked after. And, as Sarah's already mentioned, we work closely with all of our multi-agency partners and make sure that the whole support that goes into the family is as interlinked as it can be. In relation to longer term educational outcomes for some of these children, that's much more difficult to measure. However, for those who are looked after or become looked after, we've clearly got a corporate parenting responsibility, and the corporate parenting group addresses the longer term issues for looked after children in particular and care experienced young people as well. And therefore we will report back to this committee on how we're doing there. And we have also challenged all of our services within the local authority through the Children's Service Executive Group to improve outcomes for looked after children and young people, and to be really ambitious about that, so we can report on that particular element through the corporate parenting agenda. But in relation to this, it's really on that case-by-case basis, making sure that we've got the support for the individual children and families right now. Absolutely right. I do apologise, I couldn't hear a lot of what you were asking, Councillor Maitland, because the line was bad, but I hope that answers your questions.
Thanks, Stephen. I don't know if you're able to come back in, Councillor Maitland, if your line's improved at all. Oh, here we go. Yeah, so I think we'll be able to, members will be able to see in the chat there, and just for the benefit of the recording, the concern or question is also around children looked after at home doing worse educationally than those looked after away from home. And the point is, how does this service demonstrably contribute to better outcomes? And I think that's partly what you're starting to touch on there. But yeah, the question is obviously with these things is how do we measure the impact? And as you say, it's on a case-by-case basis, but is there a metric that we can capture that in, or is that something we ought to devise?
Sarah, would you like to respond to that? I seemed that you were nodding.
Well, I mean, we are measuring the different types of supports that we're putting into families and how we're doing that. And so for some families, it's about routines, which a lot of families lost quite a bit during COVID. Some families have become a little bit chaotic, and it depends on parental mental health. It depends on lots of different things. But we're trying to help families get in a better structure and routine so that children help them get back to school, get a good sleep, get up in the morning. We're helping with all of those things, and that does, for those individual children, help to show progress. There's a couple of instances where we can see that having that routine has really helped children, help their regular attendance for the ones that have been at school or been in a hub. Obviously, for individual children, as Stephen said, we would look in their child's plan at where there might be gaps or where they maybe haven't been managing to keep up with things. So we'll measure what our service does and how that might affect and link in with education. But obviously, the overall measuring will be done through what's reported to corporate parenting.
Thanks, Sarah. And sorry, is that Councillor Maitland? Were you able to hear that?
Yeah, sorry, just I said thank you very much. Yes, thank you.
Oh, sorry, that's great. Thank you, and thanks for your forbearance there. Okay, I don't have any other questions or comments in the chat. I can't see other hands up. So with that, are we happy to go to the recommendations, which is to note the progress on the Transformation Change Programme, and also the updates and progress will be brought back to this committee on a quarterly basis for review and scrutiny. And obviously the next report, the service hopefully will be more embedded and we'll maybe get a clearer picture of some of the questions that have been raised today. So are we happy to go with the recommendations committee? I'll take silence as consent.
I noted, Stephen.
Okay, thank you. Okay.
Tracy's winding me up here.
Okay, well, I'm glad you're finding your jollies elsewhere there. So the next one is on the item 5, which is delivery of unpaid work during the pandemic. Obviously, this has had a lot of attention, and we've heard about the number of hours, etc. We have Catherine Knight here to speak to the report, and I believe there's a couple of relevant updates that you might want to bring in just initially, just in terms of the impact it's having in Dumfries and Galloway. So I'll hand over to you in the first instance, Catherine.
Thank you, Chair. Good morning, members. I hope you found the report I provided useful. As Councillor Thompson mentioned, there have been a couple of significant updates since the report was prepared. Particularly, we now have a date for the date of enactment of the coronavirus regulations, and that was in fact 5 o'clock last night. Those regulations have progressed in terms of the impact on Dumfries and Galloway. That has meant that in terms of unpaid work orders which have been exempted, that worked out at about a quarter of our orders. Those are orders imposed for sex offending, domestic violence offences and stalking offences, which meant that the 35% reduction has been placed upon the remaining 3 quarters. This amounts to approximately 13,000 hours being reduced across Dumfries and Galloway. As things stand at the moment, face-to-face activity continues to be suspended. This is on the back of guidance from the Chief Medical Officer, who is recommending that this remains the case until at least late April. This is certainly frustrating because we did feel that locally we could have started to relax the suspension safely, but clearly the guidance from the Chief Medical Officer is vital there. During the time of the current lockdown, clearly court activity has slowed significantly, But building on our experience over the last year and the developments we've made in terms of developing non-face-to-face virtual activity, we have been able to continue to work through orders that remain active. So as of yesterday, the local backlog was standing at 31,000 hours. Clearly, once the 13,000 hours approximately that will be reduced on the back of the legislation, once that's accounted for, the backlog will sit at around 18,000 hours. Clearly, that is lower than we would be working with under normal circumstances. But what we do know from last year is that as soon as the lockdown is lifted and courts return to full business and indeed start addressing their own backlog, we are absolutely sure that rates of new orders will come through at they'll probably exceed the forecast as presented in the report, the forecast there from the Community Justice Scotland, in terms of the anticipated increase in demand over the next 4 or 5 years. So the report that was presented, I hope that takes you through how COVID-19 has impacted on how we've delivered unpaid work across the region. It's highlighted some of the challenges, but also how well the service has responded to the situation to ensure that unpaid work continues to be a credible sentencing option, because what we do know is that the courts in Dumfries and Galloway do like imposing unpaid work orders, and clearly ensuring that the activities that service users undertake are meaningful and worthwhile for both themselves and their local communities. Happy to take questions. Thank you.
Thanks very much, Catherine. That's certainly a rounded report, and we've already got questions coming in from Councillor Giusti.
Thank you. But one of my questions is regarding the likes of the homeworking, in the sense of bird boxes and stuff like that. How do we measure that? In the sense of, do we measure it by how many bird boxes someone creates in a day, or because the measurement that we use is hours for the CPO, but obviously there's going to be skill differences between folk, and how do you monitor that? And if someone's done maybe 3 hours worth of bird boxing and produced 2 bird boxes, and someone's made 10 in the 3 hours, etc.
Oh, indeed, you've just highlighted, I think, one of the main challenges that we do have, because clearly if someone is a skilled carpenter, they will be able to churn out bird boxes of a higher standard and a speed that someone who is new to that type of activity, it'll be far more of a learning curve. What we do is we kind of propose an approximate timing for what we think the task will take. Clearly then, when the service user produces the work that they have done, there'll be a judgment call on the effort they've put in based on what their skill level is. Does it display that they are developing a particular skill? So it's whilst there are kind of ballpark figures, we do ultimately base it on a case-by-case basis. Clearly, the principle of unpaid work, we are looking for the service users to undertake a meaningful activity which will have a meaningful outcome. Now, unpaid work works best when both sides of that equation are as meaningful as they can be. What we're finding delivering unpaid work during the pandemic is that what we've had to do is sometimes balance on the meaningful activity for the service user, ideally promoting the meaningful outcome for communities, but that's where that greater challenge has undoubtedly been. But certainly, to answer your question, as I digress a bit, the home working, we do assess the work that is produced and come up with what we think is an acceptable time to be awarded.
I can imagine that's quite difficult, especially because I've had constituents asking about, well, how do you monitor that in the sense of someone could be sat watching the football and having that and have the kids round and make it a family activity or something like that, which isn't really them doing their CPO, which there's just a lot of concerns that the public, well, a couple of members of the public that have raised with me about that.
Indeed, I mean, ideally, the home working will, under normal circumstances, home working is only used for a small number of service users and is used as part of a package. So what ideally we would have home working doing is it would almost be like homework. So the person would come to the unit, they'd be shown a skill, they practice the skill, and then the home working would be them being able to produce something on the back of the learning. Clearly, at the moment, we haven't got the service users coming in. So what I would also say is that each service user does have their own case manager who will monitor a person's activity throughout the order to ensure that there is some demonstrable progress in either a skill learning or whatever the unpaid work hours were imposed for, looking to show that actually that the piece of work they're doing is meaningful in terms of activity and outcome.
Thanks, Catherine. I mean, I think that's, yeah, it's difficult enough as it is, but clearly the Justice Social Work team and unpaid work team have been being as creative and sort of flexible as possible to sort of find meaningful ways of getting this achieved. So you know, it is going to be very much a lot of judgment involved and professional sort of assessment. So we've got Councillor John Campbell to come in next.
Chair, I think Lillian was wanting to come in.
I beg your pardon, sorry, Chief Social Work Officer.
No, that's fine, Chair. I just wanted to add on that particular point, you know, we do a risk assessment of every service user, as Catherine has indicated, and they have their own case manager. However, we work on a progressive assessment and trust and the fundamental principles of empowerment. So we do work with our service users through the risk assessment process to help them understand the impact of them not undertaking the work as instructed. We will never get it right 100%, and there is always risks to every element of that service delivery. Excuse me, in normal times, but certainly during this period of pandemic, we've tried to do things as open and as transparent as possible. But we share your concerns and some of the constituents' concerns around, you know, how people may fulfil their hours, but we certainly are trying to be creative in that process. Thank you, Chair. Thank you, members.
Thanks, Lillian. And thanks, Councillor Campbell, for pointing out that Lillian wanted to speak there. But it's your turn now, Councillor John Campbell.
Yes, thanks, Chair. Thanks, Catherine. And thanks for the report. And thanks for the update. I suppose we were looking at approximately 20,000. So going down to 13,000 hours is quite a substantial drop, especially when at December we were sitting around about 44,000. So that's a huge drop and well done, particularly on the improved range of non-face-to-face activities. I think that's made a big difference even before the Scottish Government emergency coronavirus legislation came in. So taking it from 44 to 37,000 is quite good as well. What I was going to ask was that now that the better weather's here, are there further opportunities to reduce that even further? For example, where I live, the village where I live, there was a squad out only just 2-3 weeks ago, and they completely cleared the curbside weeds, and it's been a bane for many of the villagers, not me, I may add, but they keep coming to me and pointing them out, being a councillor, And I'm just wondering with this good weather that we can maybe do a bit more for the communities. Thank you.
Thank you, Councillor. Yes, I would agree completely. The opportunities to do outdoors work is obviously an area that we do have a little bit more flexibility. There have been a number of examples of curbside clearances and litter picking, that type of activity. So yes, without a doubt, the improvement in weather comes at, yes, we're always pleased when the sun shines.
Yeah, thanks very much. Thanks, Chair.
Thank you. I mean, obviously, with the reduction in hours, I mean, the key thing is, and this is what I suppose the assurance that I would be looking for from this, but clearly, while there is a reduction in number of hours for reasons that are decided elsewhere, the key thing is that there is a sort of protection or respect for the dignity of the victims who often have to come forward and would want to know that their significance and importance was respected by the changes. So I think that's ultimately a sort of a key thing, because and I don't know if you maybe want to add a few words to that, Catherine, just in terms of, obviously you did sort of outline at the start just that with those groups that it's sort of acceptable to sort of apply that reduction, but clearly the key importance, the thing that should not be compromised is the importance of how this could impact on victims of crime. So I don't know if it's worth sort of expanding on that even further.
Yes, thank you, Chair. I'm more than happy to do so. The service users and orders which are exempt from the new legislation are those who've been convicted of sex offences, domestic violence offences and stalking offences. The thinking behind that was we do know that these are offences which go generally underreported and are really challenging to get through the courts at the best of times, and therefore it was felt at a national level that that they didn't want to make victims even less likely to come forward, having experienced those types of offences. Clearly, this is an issue that is very current at the moment. So those were the reasons behind the exemptions.
Thanks, Catherine. I don't see any other questions in the chat, and my screen's not showing me any other hands up. So on that basis, I think we'll turn to the recommendations. So we have, the first is essentially to note the impact COVID-19 has had on the delivery of unpaid work across the region since March 2020. Commend justice social work and unpaid work teams in particular in the response to the pandemic in developing non-face-to-face activities, and also to agree that a future report will be brought to members outlining how the lifting of the current lockdown impacts on the delivery of unpaid work. Are we happy to agree with those recommendations?
Agreed.
Okay. Thank you, and I see that in the chat as well. Okay, that takes us on to the final item for today, which is to note the meeting of the minutes of the meeting of the Public Protection Committee on 8th of December 2020. Are we happy to do that? I should add, actually, before you all rush to go out and play in the sun, that I think there's an apology in there from Councillor David McKee, but I don't know if that apology is necessary. I think we might have mentioned this at the last committee, because technically only one of us is meant to be there, but it's just a sort of technical correction, I think. I don't know if you want to touch on that, Lillian.
Yeah, I'll get the minute changed accordingly. You're absolutely correct. It's either the chair or the vice chair that attends, so we'll get that corrected. Thank you, Chair.
Thank you. But with that, I see that there's that members are happy to note that in the chat, and with that, I've got no further business for today. So thank you for your contributions, everybody, and we'll look forward to seeing you at the next meeting. But for now, you're free to go. Thank you. Bye-bye.
Thank you, Chair. Thank you, members. Thank you.